Volunteering for Seniors, virtual and free webinars for senior citizens and their caregivers. Good morning. This is Pratima Penumarti, founder and president of VFS, which is Volunteering for Seniors. Our mission is to reduce loneliness and isolation among seniors and help them stay more energetic. We are aiming at making sure that all seniors blend into our communities without any difficulty. And we are achieving this through meaningful volunteering. Since the year 2021, we have been conducting a number of virtual webinars, talk shows, conferences for senior citizens, also keynote presentations, general sessions, all that focuses on supporting health and self-care for seniors and their caregivers who may have dementia or without dementia across USA. Before I forget, today is World Citizens Day, so let us all make a pledge who are all here today to be more sensitive towards the issues which is faced by all senior citizens around the world. Their contribution holds great significance in our families, in our community, and also in our country's development. It is our wisdom to listen to the lessons and values that our seniors, that they have acquired with the years they have lived and which we may not reach. Today, and of course, I would just, before I start about this seminar, the entire webinar, we have, to know more about our organization, I would request all the viewers and others who will be watching this through our YouTube channel to definitely visit our website, volunteeringforseniors.org, and please don't forget to subscribe our channel, YouTube channel, Volunteering for Seniors. Today's topic is very sensitive and very important, which is male andropause and ED, erectile dysfunction, navigating hormone changes in the aging male. To a little bit talk about this, for women, getting later in age is associated with mood swings, hot flashes, which most of us know, but do men go through similar hormonal changes? So today's webinar will look more into how, utilizing body systems approach can support men's health with age-related challenges. Today, we will try to look at the interplay between hormones, nutrients, toxins, and how to optimize healthy levels of, testosterone, support prostate health, and maintaining healthy, sexual function with nutritional support. Age-related hormone changes in men are way different from those in women. There's so much to understand about it. So let's also, again, understand more about the signs, symptoms, and different options, if there's any treatment options for that. And to talk with us, to give us more explanation about it, we have with us Dr. Sapan Polepalle, who's a urologist treating patients in Brooklyn and the greater New York area. He's a member of the American Medical Association and the American Urological Association. He also holds a certificate from the American Board of Urology. As an undergraduate, Dr. Polepalle traveled to the Sorbonne, correct me if I'm wrong, Dr. Palle, as part of a study abroad program, and graduating from Northwestern University, he received both his bachelor's and medical degree from a combined program. He also attended joint degree program at the Kellogg School of Management, where he acquired an MBA. Dr. Polepalle was selected to participate in the highly competitive programs during his medical school, where he received the Society for Pediatric Research Academic Fellowship. Since then, he has been recognized for both his excellent medical and educational skills. Dr. Polepalle also does procedures which is offered by him. They comprise, a full range of urological services, and that include screenings for prostate cancer, treatments for incontinence, urinary tract infection, many more, infertility, and general urology consultations. So today, to talk more about this important subject, I have with me Dr. Rohit Chandra, who is also our board member, and I know most of us will know about him. So Dr. Chandra and myself will be asking a couple of questions to Dr. Polepalle. Welcome, Dr. Polepalle, to our webinar.
Thank you so much for that introduction. I'm here today really to shed some light on a topic that I think is present, but is often not recognized by the general public, especially as men and even women age. They may become aware of some changes in their bodies, but they may not recognize what is happening. And so those may not actually manifest as something that one seeks treatment for until it gets to a certain level. And
Yep.
knowledge is powerful. And so the more we can teach someone what to recognize in their changing their body, the more that they're aware, and the more that if they want to pursue something to help them improve their quality of their life, but by all means, let's try to do something positive with it.
Absolutely. Thank you so much, Dr. Sapan. The very first question, which everybody would love to hear and want to hear more myself, is what is male menopause? And does this hit men at any age? Or is there a particular certain age? Or do you see men all across the board with this?
So that's a great question. So I think we should backtrack and talk a little bit about how this may start. And to do so, we would need to understand what the man hormone is. So in women, the primary hormone is something called estrogen, which I think has been in the lay press for a number of years now, especially with breast cancer and things like that. So similar to that in men is something called testosterone. And testosterone is produced naturally in the body in a couple of different areas, mostly in the testicle area. And it's an essential hormone for men in their development to create being a man, meaning the testicles, the penis, the prostate. But as you get older, it has a big role in fertility. It has a big role in erection function, and it has a big role in making the appearance of a man, meaning muscle development. What we call this secondary sex characteristics, which mean the facial hair that develops as a man goes through puberty, the enlargement of the male sexual organ. So now that we have some background on what testosterone does, what happens over time. So from birth to age 17, 18, the testosterone will peak, and meaning that, especially at puberty, it will go through surges. That's one of the reasons that if one can rewind the clock and think back to when one was a teenager, a man will recall that their muscles grew larger, that they started growing facial hair, that their appetite grew, they had more energy, acne. So that will peak up to age, let's say 17, 18, and it will stay at a steady state, meaning at a normal level for a certain time. Typically around 40 to 45, a man will start to see, well, they may not see, but in their bodies, the testosterone will start going about 1% a year. There will be a decline. So sometimes that happens earlier, sometimes that will happen later. And depending on where a man falls on that spectrum, they will start to feel the effects of that menopause, andropause, if you'd like to call it that.
Wonderful. So you've mentioned the role of testosterone in normal development. What occurs when testosterone is low in adults? What are the clinical signs?
So there's a variety of effects that happen when a man has low testosterone. And I'm just referring to just some of my notes, more to have it at my fingertips. So some of the main characteristics that a man will feel is a decrease in their energy level. So the energy level, this is my dog, so you might see him in the video. The energy level is controlled by the testosterone. So what a man may feel who has low testosterone is that they just feel like they're losing some energy and they can't get through the day how they used to, kind of thing. So for example, they may notice that getting home from work becomes more of a challenge, or getting through the day is more of a challenge. So what they could usually have done in 8 to 9 hours, by like hour 3 or 4, they're just feeling they're pooped out. So that's one effect. The second thing is that they may not have the same verve. So meaning that from a psychological standpoint, that they notice that they've lost some passion, some energy for life. And now, of course, that could be a reflection of many different things, but we're specifically talking about testosterone and what are the effects here. They may notice physical changes in their body, that they may notice that their muscle has diminished somewhat in their bodies, and even they may notice that their waist has gained some more weight. But the other big side effect that really motivates men to come into my office for something like this is that they start noticing sexual side effects. And what that means is they've lost that libido. Libido is a medical term, which means that they lost their sex drive. So what used to arouse them there is just not causing that same passion anymore. And then, of course, there's the fact that the erection may not be as strong, which means that they may either not be able to get the erection, or they may not be able to fulfill the actual act of sexual intercourse.
Thank you. Who screens for low testosterone? Or sorry, just delete that part. Who would you screen for low testosterone? How does the screening process work? And which referrals come to your office?
Yeah, so typically the way the medical world works in the US is most people are seen most regularly by their primary care physician. And I would imagine most people in this audience have some relationship to a primary care physician. If they do not, they should establish one, because they're the ones who are checking for that for you holistically to make sure everything's going on. Depending on in that patient visit, when you go to see your primary care physician, if you're having any of these symptoms, it's good to bring it up, because at that time, in the labs that might be done every X number of months, meaning 3 months, 6 months, or a year, the doctor can order something called a testosterone level. The testosterone level has certain ranges, and we tend to use 300 as the guideline to say it's above a certain amount or low kind of thing. So meaning 300 and above is more or less considered normal. 300 and below 300, we consider that to be low. That can be done typically by your primary care physician, nurse practitioner, family physician. But however, if one is feeling these symptoms, one could also come directly to a urologist who could help diagnose this condition. And for those who may not be familiar, a urologist is basically a doctor who specializes in the kidneys, the bladder, the prostate, as far as men are concerned, but also deals with female conditions such as leakage of urine, which is called urinary incontinence, kidney stones, bladder cancer, blood in the urine. So there's a variety of different things we do, but we specialize also in a lot of the problems that men deal with, especially as they age.
Wonderful. In terms of the workup and the differential diagnosis, how do you think about that? And then if it is established to be low testosterone, how do you treat? So
what happens in a man's body is going to be a reflection of what's happening in the overall holistic body. Meaning if one has high blood pressure, one has diabetes, one has high cholesterol, which we qualify as something called the metabolic syndrome. That's the medical term for this three aspects of different medical conditions that come together to affect different parts of your that affect your body in its entirety. That metabolic syndrome has an impact even as a urologist on your testosterone, on your sexual function. So one of the basic assessments that we do are, we want to get to know the individual to see, okay, what medical problems are there in your body that are existing, and what's the status of those? Because if a patient is walking into the office and they have really significant diabetes, it's not going to be a surprise that someone has low testosterone and is feeling that less energy kind of thing. But it doesn't always have to be so black and white. Someone might be relatively healthy and is noticing that just don't feel right. And so one of the things that we will do at that time is check the testosterone.
Mm-hmm. So Dr. Sapan actually just wonderful questions by Dr. Rohit, and I learned a lot now about the different role of testosterone and how it happens. Could you explain to us why does this problem occur?
So it can occur because of some of these conditions that occur in someone's body, such as the diabetes, the high blood pressure, the cholesterol. But it doesn't always have to be related to that. It can be a natural manifestation of aging. As we get older, the body naturally diminishes in the production of the testosterone. And some men become more aware of it. Some men do not even realize it. And to help understand that, I will be checking testosterone levels in some guys who are very young, 30 to 40. And they may have a low testosterone level, but I ask them specifically, what symptoms are you having any of these symptoms? Which means, are you having trouble getting through your day? Are you having less sex drive? And they surprisingly do not, and they feel normal in that respect. So every medicine has side effects. So I don't necessarily want to put someone on a medicine if they don't need the benefits or of that medicine. So, but getting back to that question of what else could cause this, I mean, there's a variety of things. So this can occur as we get older. We have other things that come in. So, for example, cancer is a big thing that can occur, and a patient may need to be on certain medicines, chemotherapy, for either a limited time period or for a longer period of time, and that can affect your testosterone. One may have problems with the lungs. It's a problem called COPD, which means that you have some trouble in getting the oxygen into your body, and you may need to be on something called steroids for those kinds of things. The steroids affect the testosterone production throughout your body. Obesity is another reason. HIV is another reason. So the point is that what's happening in your whole body is going to reflect in other parts of your body, whether it be in your testosterone or your sexual function. But those are some of the highlights of things that can cause low testosterone.
Once treatment is initiated, what sorts of benefits would one expect? And also, what are the side effects of initiating treatment?
So the testosterone, there's a variety of different ways to initiate the treatment, but to address specifically the question that was asked, there's definitely some side effects to the medicine. But before, let me talk about what the potential benefits are. So if someone is noticing that they have those symptoms of low testosterone, typically within a week or two of starting treatment, they notice a change. What they're going to notice is they just have more energy. Their mood is better. They feel like their sexual function is starting to perk up in a way that they haven't seen in many, many months or years. They'll notice that over a longer period of time, that they may be even losing some weight, because what happens is that the testosterone works to increase lean body muscle. And so what that does is, by increasing your muscle, increasing your metabolism. And it also helps decrease the weight, fatty tissue that's in the body. So these are some of the long-term things. In a man that has what's called osteoporosis, which means weakening of the bones, it helps strengthen the bones. So these are some of the things that are happening in the background that you may not appreciate, but it is occurring. So there will be some effects within weeks, but there will be others that happen in months to years. Now, every drug has a cost. Nothing comes for free. And so what are the potential side effects of testosterone? So one of the big things that you need to worry about is that testosterone has, we talked about in development that it works on the male sexual organs, whether it be the prostate or the penis. So one of the things that we need to be aware of is that testosterone can, in a very small percentage of people, cause prostate cancer. And so before initiating therapy, we screen for that. And the way we screen is usually a blood test called a PSA, and we do an actual exam with our finger. It's called a rectal exam, which is very important. So that's one of the big things. It can occasionally cause enlargement of the prostate, which means that a man notices that they have a little bit more difficulty passing urine, which can be addressed in many different ways, sometimes in medicine or some small procedures that can be done in the office. Other things that you need to, if you're going to be on this therapy, it's not something that you take once and then you're done with it. You do need to be on it for a sustained period of time. And you don't need to continue it all the time. I have some men that take it for certain periods of time, and then they decide for whatever reasons that they like to be off of it for some time. So you can cycle in and out of it. But if you are on it for a sustained period of time, meaning about 6 months, once we start it, we do some battery of tests at that time. So one of the common things that it can manifest in is liver issues. So nothing typically major, but it is something that we need to monitor. And then there's something called the red blood cells in our body, which carry the oxygen in our body. And when you have too much, when you have more testosterone in your body, it increases the number of red blood cells in your body. And that can occasionally be, it could be dangerous if it's not treated or monitored. But once again, once you're under regular monitoring, none of these are side effects that cannot be addressed or fixed.
So the next question is from me, Dr. Sapan, and at what age, can generally we think that, any, male will experience some of the symptoms which you mentioned, and does the treatment also vary, with the onset of age?
Yeah, so the earliest one will typically see side effects of this andropause is in their mid-40s, but typically it happens more in their 50s, and definitely more so in the 60s and 70s. So we wouldn't screen in the younger populations unless they had some of these side effects. So most people are coming into my office complaining of ED, which stands for erectile dysfunction, which means that they're just having trouble with performance. And so if I'm seeing a 30 or 40-year-old man, just as part of the routine workup, we will check the testosterone. But in the older population, they will come to me directly with symptoms of saying, hey, listen, I think something's wrong in my body. I just don't feel right. I feel tired. I don't have the sex drive. And that's where we'll really get into it.
What is the connection between low testosterone and erectile dysfunction?
So it's not. There is a relationship because the testosterone will increase your libido and your sex drive, and having a low testosterone can cause ED. However, even with a normal testosterone, you can have ED. So one doesn't necessarily have to cause the other. However, they do often manifest together. And to give you more hard numbers, I would say that if a man does have ED and they're found to have low testosterone, in about 30 to 40% of men who we bring that testosterone level up to a normal range, they will notice that they have improvement in their sexual function. So it's not a home run where, hey, if I have a low testosterone, I'm definitely going to have an improvement in my sexual function, but oftentimes there can be some improvement.
And how often do people get erectile dysfunction? How common is it in the general population?
So since we're focusing on our target audience of 55 and over, I would say that it's going to increase each decade. So I would say in the 50s, perhaps maybe in the 5 to 7% range. In the 60s, it's probably going to become 10 to 15. In the 70s, it's going to become much higher, 30 to 40%. But keep in mind that as we're getting older, we're also having more comorbidities. Comorbidities meaning the diabetes, the high blood pressure, the cholesterol. Those are getting worse too. So we're not surprised to see the ED happening as well. So in fact, when I see a 65 or 70-year-old man who's coming to me for really nothing else but ED, I will tell him that this is a reflection of what's happening in your body. It's not, we don't treat the penis as an isolated organ. Yeah. We have to treat your body. And so what I'll ask him is, have you seen your primary care doctor? Have you had an EKG? Have you had your cholesterol checked? Have you had your, it's called the HbA1c, which is a fancy term for your blood sugar that we look over a longitudinal time span. Has that been looked at? And if they say yes and all those are okay, then fine, we'll go ahead with all the tests. But if it has not been, I'll encourage them to, I can initiate treatment, but I'll also encourage them to look at their holistic body treatments as well, and really do need to see a primary care doctor for that.
Dr. Sapan, this has called, that just made me, ask you one question, which just struck my head, is that, are there any telltale signs, which might indicate something that has changed in one's hormone levels?
I mean, it's not often that you're going to see a dramatic drop off in the testosterone. I mean, that would happen more because there's something else happening medically, meaning you're initiating a new medicine for a medical condition such as the cancer, or such as because of your COPD or something like that, that's going to cause a dramatic shift. But most of these are going to be slow, subtle changes that occur over time, which we've been kind of alluding to. So it's not often that you see the subtle change. I mean, the sudden change. When a man comes to me with a sudden change, meaning, oh, for the last month, I'm noticing that I'm not performing as well, or my drive is not there, and we just start really talking about what's happening in their life. So what's your life circumstances, meaning what's happening with your social situation. Is there a new partner involved that is causing some anxiety or stress? What's happened with your financial circumstances or your family situation, new stress, new job, because all of these have significant impacts on your sexual function and your sexual interests. So once again, we cannot isolate the man and his body and what's happening holistically from what's happening in just the sexual world.
And Dr. Sapan, even though you explained about, as a part of this hormone levels and everything, but just to revert back, what are the main causes of these hormonal imbalances?
So the causes are so there's a long pathway where there's a hormone that comes from the brain to the pituitary, and the pituitary releases certain hormones that help produce the testosterone. Anything that affects that pathway can affect this. So that's where we were talking about some of the powerful medicines that someone might be on. But other things that can affect it, if, for example, you've had any type of surgery in the brain area, or there's in that pituitary, sometimes that can produce a tumor as one gets older. So if someone has had radiation, surgery to this area, that can affect the whole, what we call axis of hormone production from the brain down. If you've gained a lot of weight in the last several years, liver issues, alcohol usage that can be excessive can cause some of these things. If for some reason you've been losing weight, especially, when someone loses weight, that's a red flag for any physician, because it's an indicator of either something that's happening in your body that's not being recognized, or perhaps in your mind, where it could be a sign of depression or some other type of disturbance that's being shown through weight loss. So, but in that type of situation, the body is under significant stress, and so different sets of hormones are produced in the body, which will completely counteract any of the sexual desire.
So just listening to this webinar, what I was typically feeling is, of course, we all know that menopause occurs for all women, of course, between the ages of 40 to 60, but the former, being quietly, quite early on the spectrum, while the later one is considered late, right? So whereas the andropause, conversely, is it true, is that andropause does not necessarily affect all men?
Yeah. So, I mean, just because you have a low testosterone doesn't mean you're going to necessarily feel these symptoms. So, yeah, I mean, someone will be leading a decent life till the end with no issues, even despite having testosterone in the low 200s or 150s kind of thing. So we always, one of the rules that a doctor always follows is we treat the symptoms and not the blood tests or the lab kind of thing. So if someone doesn't feel some badness, then we prefer not to tinker with it, because we don't want to cause more harm than we do good. And so if someone is not feeling any significant problems, we let it go. And so, especially in something like this. Now, the flip side of that is if a man is having situations where we will initiate testosterone due to physical manifestations, meaning that the body is taking a toll, is where someone is losing a lot of muscle mass. Someone is having significant problems with their bone density, meaning osteoporosis, then in those limited situations, we will initiate testosterone to help increase the overall health of the body. But those are very limited and focused situations.
Dr. Polepalle, I wanted to ask you, are there any foods or environmental toxins that can reduce testosterone? We've spoken about medical conditions that can interfere with the pathway. Are there foods or toxins that we should be aware of?
That can lower your testosterone or increase?
Yeah, that can reduce it, yeah.
Excuse me, what was the question? To lower?
Oh yeah, if there are foods or environmental toxins which can reduce testosterone, which can cause low testosterone?
There's no foods per se. Now, things that can lower the testosterone is I had mentioned alcohol, and that's something we sometimes don't realize how that affects us in so many different ways. But the alcohol causes different hormones to release in our body, like estrogen, for example. I mean, there's a couple of different pathways that happens, but one of them is that you just get more fat accumulation. And so what happens is more fat accumulation in your body, the testosterone that the body does produce gets converted in the fat to estrogen. So that's one very common example of something that can have an effect on your testosterone. There's, of course, I don't think that this applies as much to the population we're talking about, but there's something called anabolic steroids that are available. I tend to see this more in men in their 20s and 30s who want to bulk up. And these are very potent hormones that what they do is people inject these and they produce significant amounts of muscle mass, but at a significant cost to your body. So what they do is they will have a lot of liver issues. They will affect their fertility. It will really shut down the natural production of testosterone. And so people don't realize that they start becoming they need to continue to have this external testosterone in their body, without which they feel really crummy, because the body is not able to produce its own anymore because they've introduced so much external testosterone. As far as natural ways to increase your testosterone, there's not a lot of easy ways. This is one of the few situations where I tell patients to increase their red meat consumption because it helps increase lean muscle mass. Walnuts can sometimes help, but something that any man should be doing despite their age is resistance exercise, which exercise is broadly categorized into two areas: cardio and resistance. Resistance basically means push-ups, sit-ups, those kinds of things. So that helps continue your muscle mass from withering away. So you want to continue to do that because that's for general joint and muscle health, but it also keeps your testosterone at a certain level.
Wonderful. Great answers. Thank you.
Yeah, that's a wonderful one. But just relating to what Dr. Rohit asked you, Dr. Sapan, does this also come under the holistic treatments that can be undertaken to help with this?
It can be. The problem is that it's not going to be something that's an immediate benefit. It's going to be a long-term benefit. And I recommend this more to somebody who is not interested in introducing medicines into their body, but wants to try to pursue some type of treatment. So these are some of the things that you can engage in. But honestly, I mean, the amount that you might increase your testosterone is only going to be slight, maybe 5 to 10% by engaging in some of these things, because it's hard for you to rev up the testosterone in a natural manner.
Agreed. Yeah. So what do you think, Adi? This is the final question I want to ask you. Recommended screenings for men.
So if you are feeling some of these side effects, the general physician or nurse practitioner may order just something called the testosterone, but there's much more detailed ways to look at this. I had mentioned 300 as the level where we treat. That's not an absolute number. That's something that has been established more or less arbitrarily, and that's what insurance companies often use to see if they're going to approve payment for the medication. I sometimes have patients who have a level of 350 or 375 who despite being above that little slight normal threshold, they just don't feel well, and they do benefit from testosterone treatment. So sometimes the insurance may or may not pay for it. It's not a very expensive medicine. They may pay for it on their own. But getting back to the treatments, so there's general total testosterone, and there's something called free testosterone. And free testosterone is a little bit more accurate, but I don't necessarily check that in every man. We tend to look at the total testosterone. There are some other hormones that you look along with that. There's something called the prolactin, which comes from the pituitary, which is in the brain area, that can affect this. And then also check something called estradiol, which is the man estrogen hormone, to see if that's not out of whack. Because if that's out of whack, that can sometimes affect the hormone balance, even with a normal testosterone.
And is it like, this is my question, because I heard like some of the seniors talking, but is it like any chronic stress or poor quality of sleep, which generally I see most of the seniors have very poor quality of sleep for a particularly long period of time? Can that have a profound effect on testosterone production?
Yeah, I mean, so that comes under the category of general stress on the body. So if there's some major stressor on the body, that's going to affect all aspects of your body. So definitely, I mean, if your sleep cycle is messed up, it's probably going to affect your testosterone production. There's a whole physiology behind testosterone. It's called the circadian rhythm, and it tends to be highest in the morning, and it tends to decrease over the course of the day. So, if you want to be technically accurate, we like to check the testosterone before 10 a.m. in the morning, and then get the best picture. If someone has a low testosterone, is it truly representing what's happening in their body? And we would ask them to come in the morning to check that level.
Yeah, I think we asked a number of questions. Dr. Roy, do you have anything else to ask, or we can keep it ask whoever would be interested to ask any questions to Dr. Sapan?
Well, I can. There's one other thing that we didn't really touch on, and that was the actual treatments.
Please, that will be the. I'm sorry, I know we missed that. Yeah.
So there's a variety of treatments available, and some of them are brand new as well. So we somehow need to get the testosterone into our body, and the oldest treatment is something called testosterone cypionate or enanthate, which is an injection that is injected every 2 weeks. And it's like an oil-based medicine that needs to be injected into the muscle. And typically we teach patients how to do it, and they do it themselves every 2 weeks. And so what they'll notice is the first week that the level goes up in their body, and then the second week it starts going down. And so that's why we keep that 2-week window, although that can be adjusted. So that's the cheapest and most straightforward way to do this. And to give you a price, it's like $20 or $30 per month. So it's very cheap. In the last 20 years, there's been other ways to get that medicine as well. And those are gels or creams that are either put on your shoulders or on your legs or on your chest. And those work quite well, but they need to be used every day. And they work, all of them have the same side effects. One thing that to be aware of if you use a cream or a gel is that once you put it on, you need to let it dry, because if you have close contact with a family member or a child, that gel could theoretically spread to the family member. So that's something to be aware of if you're going to use the cream or the gel. Sometimes the doses need to be adjusted. And then one of the newest way to get the testosterone in your body is actually pills, and they just came out last year. They've been in Europe for several years, but they just got FDA approval, and they work very well. The problem is that most insurances don't cover it, so it's not something that I have a lot of experience with because my patients can't afford it. But that's not a problem. I think the creams or the injections work just fine, and so there's a variety of ways to get them, and I think most patients, if one doesn't work, we have to just transition to another, and it's just finding out what works as well. One final thing that I didn't mention is that there are these pellets that can be implanted in your body that release the medicine over time as well, and that can be used once you try the testosterone and you realize you like it, and you're not into trying one of these medicines that you have to use every day or 2 weeks.
So, Dr. Sapan, I mean, just hearing all this, I feel, do you think that the blood sugar imbalances, even the insulin resistance, or, even the abdominal fat, which we see in so many males at a certain age, do all of this impact the symphony and the production of hormones?
So yes, absolutely. So, diabetes is it just ravages the body. And I think sometimes patients don't realize how much it has an effect, from your foot to your eyes to your hands to your nerves, and nothing is immune from diabetes, and it affects this as well. So I would not be of the mindset that be like, well, okay, I got diabetes, so I should start taking testosterone to fix my diabetes. That's the wrong approach. The approach should be, I need to fix my diabetes, and then while I'm doing that, if I have some side effects along the way from what the diabetes has done to my body, let's try to address those side effects. So the primary concern is really, what can I do to change my diet? How can I increase my exercise? How can I lose weight? Because that's the three things that one really needs to focus on if one is overweight, has diabetes, has high cholesterol, has high blood pressure. So once again, I emphasize that we need to treat the body and not the individual symptom that we have at hand.
Thank you so much, Dr. Sapan, with all this information. And we're opening this panel for people who are watching this webinar. Do you have any questions, please feel free to ask questions now to Dr. Sapan. Else you can also email us, and we can share it with Dr. Sapan eventually. I do want to just take away from what we have spoken till now, Dr. Sapan, is that, and first of all, I want to thank Dr. Rohit for asking beautiful, wonderful questions to Dr. Sapan, because andropause and, questions of erectile dysfunction is something very new to a lot of people. And honestly, every one of us, most of us just talk about menopause, but we do understand now that men go through andropause, which is, again, as Dr. Sapan said now, it refers to the hormonal changes that men experience through later in life. Menopause has historically been a taboo subject, right? But I would always say that by increasing your own awareness, everyone can have a strong positive impact on the people. It can have a very big impact in your own personal life. So health education, like today, what we're talking about, health education about andropause, helps men adjust to the gradual changes in older ages and ultimately increase their sense of well-being and prevent further difficulties. Is there anything else you would like to share, Dr. Sapan and Dr. Rohit? Do you want to say anything else?
We didn't talk a lot about ED, but I think that is another. I think it would benefit from a talk on its own at some point. But ED is when one experiences ED, don't ignore it, and things can be done for it. And I think it's important that one realize one does not have to feel like, okay, I'm old, or I've crossed a certain point in my life and I just have to say goodbye to that aspect of it, kind of thing. If feels that that's something that one would like to continue, it can be achieved. It may take some time, it may take some procedures, but there's different things that can be done for it. So.
It was a wonderful discussion, a wonderful talk, Dr. Sapan, even though it takes time for most of us to understand everything now in just one talk show to understand. I think I believe that there's a lot of information we did get today, and down the lane, we'll have more such webinars where we can gain more information about ED, and if there's anything more that we would like to know about Andropause. This is for everyone that is just quickly wind up about our organization. Our VFS goal is to connect people to resources like this, what we had today with Dr. Sapan, and promote aging with independence and increase community awareness of aging issues and generate community-based solutions to these issues. So thank you everyone for attending our webinar today. And you can also watch it eventually on our YouTube channel. Dr. Sapan, thank you very much for giving your time for today's talk. And I'd like to hear more from you eventually.
Thank you.